Good afternoon, ladies and gentlemen. Welcome to this session. I hope that we're going to have a dynamic discussion starting by this talk, but also in the next panel. And my objective in the next 15 to 20 minutes is to ensure that I share with you maybe a different perspective of what we need to be focusing on as a pharmaceutical industry, but the healthcare environment overall. So the first thing we need to face is that in many countries, whether the economies are going in the right direction or in the bad direction, there is huge pressure on the healthcare costs, and it is becoming very non-sustainable for many countries to actually operate. And trust me, this is also for the most productive economies. So it's not an issue just of where we have austerity. And I believe as an industry and a healthcare system, we should not put our head in the sand and look like we don't know what's going on, because the first step to try to change that is to face the truth. Our payers and our governments are facing a problem that we need to be addressing altogether. Now, when you couple that with austerity, it becomes a real challenge. So our situation in Greece, we not only have the aging population, the high cost of chronic diseases, and we have very high unemployment. So very few people are contributing to healthcare in terms of spending. And at the same time, 50% of the people are not working. So you add this, it becomes a very complicated issue. And to continue to focus only on cost is no longer sustainable. So we need to break out from the single view, one lens of the healthcare system and the healthcare provision, which is just about cost of healthcare, to other parameters. I have been in Greece for the last 2 years. How many times did we discuss quality of healthcare delivery compared to the budget and the cost? At the end of the day, if it costs nothing, but if it's of no value, what is it worth? This is the reality. It could cost zero. But if at the end of the day, the quality is significantly below what is expected, it's a big issue. The other topic is the innovation. What place are we making for the innovation? Not for the sake of pleasing the industry, because innovation is there to add value. To add value for an unmet medical need that is needed by the patients and by the medical community. So we need to ensure that we move our focus on healthcare just from cost to a number of other variables and focus on how we can actually drive value, drive the economy at the healthcare system. So one of the examples is, in Germany, for example, if you look at the contribution of the healthcare sector to the GDP, 1/10 of euro is produced by the healthcare system. 1/7 of the employment, for example, is contributing to the economy. Are we asking ourselves in Greece, what are we contributing to all this? Because in many situations, the whole pharmaceutical industry is looked at as more of a drain for expense and cost, rather than a true contributor in terms of growth. Now, if we look at the data that we have in Greece in terms of the contribution of the pharmaceutical industry, we can already see that there is a significant contribution to GDP, whether through direct, indirect contribution. And, I believe we need to do a far better job to communicate the value added that we are bringing as an industry to the economy. Because if we are seen only as I said, a cost drain, then definitely this is not going to enhance the collaboration that we need to have with our governments and our key stakeholders. Now, if we look at the contribution of our current industry to employment, we see that overall there is almost 132,000 jobs created, whether direct or indirect, by the industry. And I believe we are not spending enough time to talk about this. Today, to see that the industry still employs at a time of crisis, and I worked in 7 countries before. So I can compare very well how many people are working, for example, in the industry in France compared to how many people are working in the industry in Greece. And I can tell you, up to now, despite the fact that we have seen reduction in headcount, there is still a very significant contribution to employment that unfortunately is passed unseen, unobserved, and maybe unrecognized. And we have an important job to promote that because we believe that this is a significant contribution to the economy. So it is the time to change our perspective on, health, which could be seen by many people as, a drain of resources, to a true wealth that different economies have. And the only way to do this is by stepping back and reflecting as to what health really brings to a society. The first thing that it really brings is productivity. Productivity, because if we have unhealthy citizens, then the level of productivity is going to go much lower, and consequently, we are not going to be as productive as we need to be as a country. The second most important theme is education. Obviously, when we have healthy citizens who are more focused on upgrading their skills, capabilities, and investing in education, this is driving more wealth to the society. And lastly, with more longevity and with people, going to higher ages, we have an even bigger contribution in terms of capital generation and capital creation as a country. So how to strike a balance between this difficult dilemma of, so how much access needs to be there? Because let's face it, we are coming from a system where it's open access, okay? And at the same time, we moved from the extreme left to the extreme right, where today we have zero access, because it was total access before, up to no access. And the other parameters, which are quality and cost. Quality and cost. Today, we do not step back to reflect as to, is there a relationship between those 3 parameters? Is there a way to have a balanced approach between access, cost, and quality? So to do so, a number of principles can be useful. The first principle is to focus on value and not on budget. So if we look to a number of disease entities, and we could take many specific examples of different disease entities where we know for a fact that we have a high budget. Is this really correlated with an improved patient outcome? Yes or no? It's a key question, because the focus needs to be on improving patient outcome. If that can come with a lower cost because generics are available and generics are far cheaper than patented products, great. And the innovative, industry is going to be the first one to say, let's move in that direction, because that frees investments to go into real innovation when we need it. So we need to refocus our attention from just thinking cost to what value are we bringing, and we have to be very honest with ourselves. So as a pharmaceutical company, if there is a better product that can provide the benefits to the patient at a cheaper cost, we should allow that, because this is going to make the system more sustainable. Trying to fight that is very short-sighted and will not get us anywhere longer term. Now, another important principle is to focus on the patient, not just to ensure that there is a significant contribution from the patient in terms of copayment, because this impacts the budget, so that it solves our problem, in the short term, but to truly empower the patient to take hold of his own health and wellness. A better informed patient who knows what is the difference between the different treatment regimens, what is the impact of health, diet, exercise on his outcome, is a patient that is going to be getting better outcomes. And today, we are not focusing a lot on the patients, and that's something that we need to work on more heavily as a healthcare system. A third thing that we need to address is the level of ineffectiveness, inefficiency that we have in the system. Unfortunately, if we compare the healthcare system, our industry overall, public, even private, to other systems, we see that it's very fragmented and there are huge inefficiencies that exist in the system. So unless we address these, the underlying problems will remain the same. And we'll be scratching the surface, trying every time to look at one budget and to superficially fix it, while deep down there are big fundamental infrastructure challenges that we need to address. The first one has to do with labor and labor productivity. And we're all, watching the big debates about, the number of civil servants who need to be at A, B, C, or D, and what productivity, they remain. And I believe that even as an industry, not the healthcare system, so instead of pointing the finger, we have to ask ourselves, how productive are we with the labors we have? Because over many decades, the job definition of people involved in the healthcare have not changed, unfortunately. If you look at even the relationship, the way the physician interacts with the patient over the last 30 years has not changed much. While if you look at different industries, you'll see that the relationship between the service provider and the service receiver has changed dramatically. While we have stayed where we are, whether as, at public institutional level, but even on private industry level. Another important factor not to forget is adherence to therapy. Right? So, we might say that this product is reimbursed and it's available. But how much time are we spending to ensure that the patient is really going to follow his regimen? Because if he doesn't, there is no value created. Right? It's only cost. If the patient receives his medicine to control his blood pressure or his cholesterol or his diabetes only for 100 days out of the 300 plus, so what potential outcome will get out of there? So we have paid a fraction of the cost, but at the end, value was not created to the patient. So we have to focus a lot on such topics, or else the government will not achieve its objectives in terms of improvement of healthcare in Greece. Another important principle is how are we addressing the coordination of care? And this is an example from the US where you see, Kaiser, where we have, of course, in the US, all of the healthcare providers are private. So there is a lot of investment in coordinating care and ensuring that it adapts to the needs of the patient. I believe this is a real area that we need to work on in Greece. If we look at provision of healthcare in the remote islands, and we compare it, for example, with Athens, where half of the population exists, how far today are the AOP from the hospitals and how much effort the patient has to do to go right and left to get his medicine at the end of the day? Sounds like very basic stuff, but this is what's going to make the difference at the end of the day in the life of the patient. There needs to be a better coordination of the care delivery. And that can only happen by focusing on the patient. What is the patient journey? What is he going to do from the time he's going to queue in the hospital that we see to see his physician until he gets today his printed out prescription from the new e-prescribing system? But to fulfill that, to take his medicine, what does that journey look like and how we can coordinate better the delivery? So we need to trust innovation. We need to trust innovation. I believe in Greece, there was a phenomenal step taken by the Greek government to implement the e-prescribing system. I believe that this was a very, very positive move, and I believe many of us need to feel proud about what has been implemented in Greece in very little time, and as I heard, with little cost compared to many other markets. So definitely technologies are coming in, but we need to ensure that we go even further. MSD was involved in a number of countries, for example, in a number of initiatives to see what is the value that we can bring with remote patient monitoring, for example. And what sort of value does this bring to the patient, to the healthcare provider, what savings that is make in terms of visits to the hospitals. And when I look at healthcare provision in Greece, I believe that that's an area that can definitely serve and save money and become more efficient at the healthcare system. Now, obviously, many of us are involved in Greece in different technologies. So I have seen many working with the patient diaries and all sorts of tools to help the patient be more empowered, because that's not going to happen just by working the old way. But we should not forget that the most important innovation we need to focus on is our therapies. Because if we are not bringing new innovative therapies, we are not going to make a difference with the unmet medical need. And today, to bring new innovative therapies, we know is becoming more and more challenging. Why? Because it's becoming more expensive. Two, because the requirements of the regulatory bodies are becoming far more challenging. But we need to continue to focus on that. And if Merck today, MSD, continues to invest some $8 billion in R&D, is because we realize that, frankly, the private sector has to focus on investing there, because if we don't, nobody is. Because nobody can bear the cost of failure of pharmaceutical innovation like the private pharmaceutical industry. So principle number 6 is we need to see how we can evolve the model, how we can work all together with different stakeholders, not just to focus on the drugs, but to focus on different needs that will help our governments and our systems perform in a better way. So for example, health informatics is a very critical thing. I mean, today, we have the e-prescribing system. What are we doing with the data that's in there? What are we doing with the data? One part is the cap of 15% of, the patented products. But the other thing is the right patient receiving the right therapy? It's a key question. It's a key question, not because of cost, but because of value, because if an expensive product is used with the wrong patient, it's a waste. And we don't want this waste. We want the expensive product to be used with the patients who needs that, not the patient who does not need that. If there is a cheaper option that can achieve the medical need, we should all promote this. Because by doing so, we are going to free resources for the true innovations when they come, and we would not be cornered as we have been for the last 3 years. Finally, I think it's a source of pride to be working in a company that focuses on pharmaceutical innovation. MSD has been, in the market for almost 150 years and has produced 60 true innovations in the market in the last 100 years. And the only way to survive and to get innovation to continue is to make space for that. And the answer is to focus on value and the value we really bring to patient outcome and not just the cost. Thank you very much for your attention.